All right, welcome to this explainer on Medicare Part D. If you're navigating the Medicare maze right now, you probably already know that prescription drug costs are one of the biggest reasons you need to shop around every single year. So we're going to jump right in. We're looking at why reviewing your plan before the December 7th open enrollment deadline is literally one of the most critical financial moves you can make this year. Because look, your health might not have changed, but as we're about to see, the rules of the game absolutely have.
Okay, let's get right into the biggest change. For 2026, there is a brand new hard annual cap on your out-of-pocket spending for prescription drugs. And that magic number? It's exactly $2,100. This is a massive shift coming from the Inflation Reduction Act, and it means real money is on the line if you don't optimize your coverage. If you happen to take expensive medications, this cap is an absolute game changer. But you've got to be in the right plan to make sure your specific drugs are actually covered properly so you can reach it.
And while we're talking about crucial numbers, we really can't ignore this one, 63. You absolutely have to act on time when enrolling in Part D. Why? Because going just 63 consecutive days without creditable prescription drug coverage after your initial enrollment period triggers a penalty. And here's the real kicker. This isn't just a one-time slap on the wrist fee. No, this is a permanent late enrollment penalty that gets added to your Part D premium for as long as you have Medicare drug coverage. It literally sticks with you for life. Timing really is everything here.
So here's our roadmap for today's explainer. First, why review Part D? Second, the big rule changes for 2026. Third, we'll compare your plan types. Fourth, navigating those tricky tiers and rules. And finally, number 5, your essential open enrollment checklist.
All right, let's hit Section 1. Big rule changes for 2026, featuring the long-awaited end of the donut hole. Let's look at this 2026 paradigm shift. For years, people absolutely dreaded the infamous donut hole. You know, that incredibly frustrating coverage gap where you suddenly had to pay a way larger share of your drug costs right in the middle of the year. Well, good news, it's officially gone. It's been replaced by a much more straightforward 3-phase structure. Phase 1 is the deductible, where you pay 100% of your drug costs up to your plan's limit. Now, legally, that maxes out at $615 in 2026, though a lot of plans will actually offer a lower or even a $0 deductible. Phase 2 is initial coverage, where you just pay your standard copay or coinsurance. And finally, the catastrophic coverage phase. Once you hit that new $2,100 out-of-pocket cap we just talked about, boom, the plan takes over and pays 100% of your covered drug costs for the rest of the calendar year. It's just so much cleaner, right?
To make this even easier to manage on a month-to-month budget, 2026 brings another fantastic feature, the Medicare Prescription Payment Plan. People sometimes call this smoothing. It's completely optional, but it essentially lets you spread your out-of-pocket prescription costs into monthly installments across the entire calendar year. So instead of getting hit with a massive, terrifying lump sum at the pharmacy counter in January or February while you're trying to meet that deductible, you just pay it off in smaller, predictable chunks over time. Now, to be clear, it doesn't lower your total overall costs, but man, it makes your cash flow infinitely more manageable.
Moving on to Section 2, comparing your plan types, and specifically, choosing how you actually get your drug coverage.
When you're acquiring coverage, you basically face a fork in the road, and you've got to choose the path that makes the most sense for your personal healthcare strategy. Option 1 is a standalone Part D plan, or PDP. You buy this alongside Original Medicare. The real beauty of a standalone plan is the flexibility. It means you can switch your drug plan every single year without ever touching your underlying medical coverage. Option 2 is Medicare Advantage, or MAPD. With this route, your drug coverage is bundled directly into your medical plan. It's a super convenient all-in-one package, but here's the catch. If you ever need to switch your drug coverage because, say, your medication's changed, you usually have to switch your entire health plan right along with it.
Okay, Section 3, Navigating Tiers and Rules, or in other words, how plans price and restrict your medications.
So every single January 1st, Part D plans totally reset their formularies. That's their official list of covered drugs. They shuffle up their pharmacy networks, and they completely change their pricing tiers. Generally, Tier 1 means preferred generics with the lowest copays, sometimes literally $0. As you move up to Tiers 2 and 3, you're looking at standard generics and preferred brand names with moderate costs. By the time you hit Tier 4 and the specialty tier, you're facing some pretty significant coinsurance. Now here's why this matters so much. The exact same pill can be a Tier 1 on your insurance plan and a Tier 3 on another plan right down the street. This is exactly why last year's perfectly cheap, affordable drug could suddenly break the bank this year, even if your health hasn't changed one single bit. You absolutely have to shop around based on your exact medications.
But hold on, because just finding your drug on the right tier, that's really only half the battle.
Beyond just assigning pricing tiers, insurance plans use specific restrictions to control their costs. I like to call these hidden hurdles. They're extra bureaucratic steps you've got to clear before your medication is actually covered at that listed price. And if you aren't prepared for them, they can totally delay your much-needed refills.
The first major hurdle you might run into is prior authorization. If your plan puts this restriction on your medication, you can't just stroll up to the pharmacy counter and get it. No, your doctor literally has to contact the insurance company and prove medical necessity before the plan will even agree to pay their share. If you don't know this is required ahead of time, you're just going to get turned away at the pharmacy. The second hidden hurdle is something called step therapy. This is a practice where the insurance company actually forces you to try and effectively fail on a cheaper alternative drug first. Only after that cheaper drug proves ineffective will the plan finally step up and pay for the more expensive medication that your doctor originally prescribed. As you can imagine, this can be a hugely frustrating delay in your treatment plan.
And the third restriction to look out for is quantity limits. This one is exactly what it sounds like. The plan sets a hard cap on the exact number of pills or dosages you're allowed to receive in a single month or specific time frame. So if your doctor prescribes 2 pills a day, but the plan's quantity limit is, say, 30 pills a month, you're going to end up with a coverage gap that requires a special exception request.
Which brings us to Section 4, your open enrollment checklist. Let's talk actionable steps you need to take before December 7th.
Now that we've decoded all the jargon, unpacked that new $2,100 cap, and exposed those hidden hurdles, let's build your actual strategy. You have until December 7th, and this master list of tasks is how you guarantee you're in the best possible position for next year. First, pull an updated list of all your medications. Next, you absolutely must read your annual notice of change letter. That's the document from your current plan detailing exactly how your coverage is shifting for next year. You want to check preferred pharmacies and definitely look up plan star ratings for customer service. But most importantly, compare total estimated annual costs. Please do not just blindly pick a $0 premium plan. Think about it. A free plan with a massive deductible and terrible copays for your specific drugs is going to cost you way more by December than a plan with a $30 monthly premium that actually covers your drugs perfectly.
Now, if that whole master list feels a bit overwhelming, don't worry. We can distill the whole thing down into 4 really simple, highly effective steps. Step 1, list out every single medication you take, including the exact dosage and frequency. Step 2, take that list and plug it directly into the Plan Finder tool over at Medicare.gov. Step 3, let their tool do all the heavy lifting and math to compare the total annual costs across different plans and preferred pharmacies right in your zip code. And Step 4, hit submit on your choice before that December 7th deadline. It really can be that simple.
While you're doing all this research, you've got to remember to look into mail order options. Using a local retail pharmacy usually means monthly refills and standard copays. But so many Part D plans offer significantly lower copays if you switch over to a mail order pharmacy for a 90-day supply. Honestly, if you take a stable long-term maintenance medication, just checking your plan's mail order pricing can meaningfully lower your annual drug spending without you even having to change your underlying insurance plan. It's a great little hack. Also, I really want to make sure everyone is aware of the Extra Help program, which is also known as the Low-Income Subsidy. If your income and resources happen to fall below certain thresholds, this program is incredible. It can drastically reduce or sometimes completely eliminate your Part D premiums, deductibles, and copays. And the absolute best part? You don't even have to wait for open enrollment to apply. You can contact the Social Security Administration and apply for Extra Help at literally any time of the year. If you think you might even be close to that threshold, it is absolutely worth looking into.
So I'm going to leave you with this final, critical thought as you get ready for open enrollment. Your health might be exactly the same today as it was a year ago. Your doctor might have kept your prescriptions exactly the same, but because insurance companies are constantly out there renegotiating rebates and reshuffling their pricing tiers, has your plan's pricing shifted entirely under your feet? Take 20 minutes, run your medications through the Plan Finder, and make sure you aren't leaving your hard-earned money on the table for 2026.